Throughout time, the field of healthcare and medicine is constantly evolving. The field of healthcare and medicine is an area in which there is always room for improvement and growth. This being said, since the moment I was born, the field of medicine has been innovating at a pace that many cannot even wrap their head around. To begin, we start off with the most simple tool of medicine, the stethoscope. The one tool that every single person can identify as the insignia of medicine. First invented in 1816 by René Laennec, the stethoscope started off as a monoaural wooden tube in order to amplify noise at a comfortable distance from the patient, specifically at that time relating to women. Expanding on this, the sound quality and accuracy of noises was nowhere near up to par with medical standards for even that time period. We go on to look at our stethoscopes now, full of technology allowing the physician to amplify noises accurately at the same time as recording it. Brands such as Lippmann, Echo, AdScope, ThinkLabs, MDF, and many more have turned a simple wooden tube instrument into something that has the power to change someone's life today. Furthermore, stethoscopes have evolved into becoming electrocardiograms, otherwise known as EKGs, a tool that was not discovered until the early 1900s, specifically 1914, by Paul Dudley White. As shown here, the Echo Duo is one of the most technologically advanced tools of medicine that we have today, allowing patients to have a scan of their heart taken even from the comfort of their home. Now, this may seem as something of little significance, but imagine the amount of individuals pre-1914 with no access whatsoever to cardiology-based medicine, dying of easily curable heart conditions because they had no way of scanning for abnormalities. We now can do this from the comfort of their own home. Now we move on to robotic surgery. Precision is key when it comes to surgical procedures, especially when it comes to patients of acute illnesses as well as children. Da Vinci and other reputable brands give the chance for higher surgical success rates through the use of technology by offering a tool that allows for more precision than ever imagined in the past. The first evidence of surgical procedure dates back to as early as 3000 BC, where there was no use of anesthesia, sterile field, or any medical tools that were of any sort of advancement whatsoever. In a time like this, tools such as backyard hammers, kitchen knives, and regular saws were used to perform surgeries on patients such as trepanation, a procedure where you drill a hole into someone's skull. Something as scary as this sounds like it needs much precision, but at that time it was just unavailable whatsoever. Lower likelihood of survival, increases in infection, malpractice were just some of the things that were occurred at that time period due to the lack of advancement. Much of this is eliminated today or limited to the highest degree, truly allowing this time in medicine to be one of the most sophisticated and life-saving. Then comes the price of these advancements. It is often argued that too much money is being spent on advancement of medicine, or medicine is too expensive, or medical procedures just cost way too much. But if you take into account the amount of lives saved and other different procedures that truly cost that much money to even the hospitals, it's honestly not that much of a price. Or a price well paid, may I add. People argue that a simple surgery such as a cyst removal costs thousands of dollars, and that is truly overpriced. But as these tools used to even complete the simplest of procedures, scalpels, UV lights, and other sterile field tools, these tools cost the hospitals and outpatient centers thousands and thousands of dollars per year, but solely for the purpose of saving lives and allowing the highest life expectancy possible after the procedure is over. If the main motive in medicine is to make money, doctors would not have the results and successes that they do, as they work to better the society around us, providing new hope for life in ways that many people cannot. The cost of medicine is highly outweighed by the benefits of medical innovation for the majority of patients in need. Now, we also take into account patients that truly cannot afford this medical care. There are always other options, and to say that medical advancements are for the sole purpose of creating money is just truly false. We take into account tools such as insulin that, yes, have been overpriced, but we work towards lowering those prices to the point that many people can access this and many people can have their lives saved. Now, not all people in medicine are as joyful as we would like and as truthful as we would like. But the main motive in medicine is to allow for the highest possible degree in life, allowing for the best life possible, allowing for the safest life possible. And we work towards that every single day by creating new medical advancements, by innovating our current medicine, and by giving hope to new patients.